Well, Ebola is a virus that causes severe illness. It spreads through direct contact with the blood or bodily fluids of an infected person or animal and contaminated objects. Early symptoms can feel like flu at first, with fever, fatigue, headaches and muscle pain. But over time, the virus weakens the immune system and damages organs. Patients may suffer severe dehydration, hemorrhages and death. There's no approved vaccine for the Bundibugyo virus strain, which is associated with the outbreak in eastern DRC and Uganda. All right, I'm joined now by Anne Ancia, the World Health Organization representative in DRC. She is in Bunia in the Ituri province, which is the epicenter of the latest outbreak, and you are effectively at ground zero as it stands. Tell us what the situation is like there.
Well, the situation is complex. It's really difficult. As you know, we are at day 4 of the declaration of the outbreak, an outbreak that has been rampant and transmitting and disseminating silently for days before it was really properly diagnosed. And now we are at day 4 of the response. Yesterday was a very good day for us because, I was actually on the ground. I was in Bunia. I was on a mission. I just arrived as a representative of the World Health Organization just a few months ago. And I was on an assessment visit of these very, very complicated provinces of Ituri. And then as we were talking with the provincial health authorities, they told us about, an increase of deaths, related to symptoms that were, fever, diarrhea, vomit, and vomiting, and then in some cases a little bit of, epistaxis or hemorrhages. And then we did some sampling, in the laboratory in Bunia, but that laboratory didn't have the right reagent. It was a reagent that could deal with Ebola Zaire, but not diagnose the subtype of Bundibugyo. And so the disease has been rampant for some time, just diagnosed 3 days ago. And now we are really getting into the response. Yesterday, no later than yesterday, we brought in Bunia 40 of our health experts from the Ministry of Health and from the World Health Organization. So the experts who were already on the ground in the Democratic Republic of Congo. We brought as well yesterday more than 12 ton yesterday 5 ton, and then today we added an additional 7 ton of supplies on the ground, so that we can really start the operation and really try now to put that outbreak down progressively.
Okay.
It is going to be extremely complicated to put that outbreak down for several reasons. First, because, as I said, it has been rampant for a few weeks already. Then some of the areas where we have to go and operate are with high insecurity for the time being. Those are areas where there are already communal fighting and ethnic fighting that is happening. It's areas where there is, because of those fighting, but also because it's a high mining area. There is a lot of movement of population, and this movement of population has really actually this outbreak to silently disseminate with the people moving. So the situation is difficult, but now we've got people on the ground. We've got the first supplies on the ground, and we are really starting the response operation. For the time being, together with the Ministry of Health and the World Health Organization, but we know that some additional experts are joining. We've got the International Organization of Migration, who will start helping us with surveillance at borders. You know that there is already 2 cases that went into Uganda, crossing the border from Bunia here. So the borders now are under heightened surveillance, and Uganda is also increasing its preparedness.
Anne, I'm so sorry to interrupt you, because it's all very interesting, but I'm conscious of time here as well. And I just want to ask you, because there is another impact, which I'm hoping you can touch on for me. The US has withdrawn from the World Health Organization, and along with it, billions and billions of dollars has gone. So I am hearing a very reassuring message from you, but I'm also worried and wondering how much this has impacted your ability to respond to the crisis.
Well, yes, I think that last year we were very, very, very impacted with the diminution of the finances. Right now, we are using our own supply and our own human resources that were here in Kinshasa, because of course, it's not the first time that we've got an outbreak of Ebola virus. So we are bringing everything that we've got in our warehouse. But certainly the lack of US financing might hurt us. Maybe the US will give to other organizations who will soon come on the ground. But we've got, for the time being, we've got the UK, FCDO has been very generous and has been, providing us with $1 million to kickstart this response. We've got our own funding. You know that we've got a contingency fund for emergencies, and we've been mobilizing some money from there. And now we've got partners who are coming and asking us, for help and how much we will need. We think that we will need at least for really being able to tackle the current outbreak, something like 30 million. And we for the time being, as I said, maybe 2, 3, 4, 5 millions, but we will need more. And yes, we'll see how we can do, and if partners other than the US can really help us to tackle these very difficult epidemics that we are facing here. Not us, but mostly a population that is already extremely, extremely vulnerable, fragilized by years of communal conflict here. You know that the outbreak is already spread in North Kivu, which is another highly affected provinces of DRC, where there is a humanitarian crisis that is unfolding for years, and that has been scaled up last year with de facto authorities taking the town of Goma, where we've got already as well two confirmed cases on the border with Rwanda. Rwanda is closing its border, just letting some humanitarian response coming in. So yes, we will need other donors to step in and help us really to be able to bring the finance and the fundings that we need to be able to, it's mostly to contain the outbreak. We don't want the outbreak to spread further. We don't want the outbreak to spread in Uganda, to spread in South Sudan, or to spread in Rwanda or beyond. So we really need, for the time being, to be able to cut the transmission of the outbreak and to contain it, not beyond where it has already spread.
Indeed. Thank you so much. Anne Ancia, the World Health Organization representative in the Democratic Republic of the Congo.